I was once a skeptic, but medical cannabis has literally saved my life.
I'm a mom of 4 children, and I live here in Davis County in Kaysville. And I also suffer from the debilitating condition called trigeminal neuralgia. I have it in the region of my sinuses, where it feels like I have an ice cream headache that does not ever go away. I've suffered with this 24/7 for the last 6.5 years. I have tried many different pharmaceuticals. I've also had brain surgery called an MVD surgery where they release the nerve in my brain. I also have a stimulator implant in my face in this region. None of these have helped my pain. The only thing that has helped some has been the use of opiates. Every day I have to deal with the fact that I'm taking a drug that could possibly lead to a drug overdose.
Most of the patients that I see in clinic come in very frustrated, usually upset by the way things have gone because it usually hasn't gone their way. They've had to have surgeries or they've had other problems and their pain has been very difficult to control. We're currently in a crisis in regard to opioid use and abuse. In fact, opioid deaths are continuing to rise. There are now more people killed from opioid overdoses than automobile accidents in the United States.
You hear so much about addiction going on, and it's hard to deal with because I'm not addicted. I'm dependent on it. I don't have a life if I don't have opiates because it gives me a little bit of relief. It brings my pain down from a 9 to a 7. You can't live at a 9. You can live at a 7. It's not comfortable, but it is possible.
In Utah, we're losing on average 24 people a month to opiate overdose. A few years ago, the Journal of American Medical Association published a report indicating that 25% reduction in overdose rates happened in states that had a comprehensive medical cannabis program. That means by legalizing medical cannabis, we could potentially save 6 lives a month, to say nothing of the conditions like epilepsy and cancer it could help.
I'm a mother of 8, including Matthew, who has epilepsy. He had his first seizure when he was 5. In the first few years, Matt would just have a seizure once every couple of months. He worked up to having them every week, and then eventually he worked to having them every day and got up to the point where he had 40 or 50 each day. We have seen a whole team of neurologists to assist with him. He's had 7 different medications that he's gone to the highest dose with those, and one of them has helped him get down to 30 seizures a day. But that was as close as they could get, and the doctors really didn't have another solution. What we have found is that the CBD took him down to a level of 5 seizures a day, and when we added the cannabis, that it took him down to having 1 seizure every 2 to 3 days.
I know that in my becoming receptive to the idea of medical marijuana, it initially started when my brother died. He had developed a sarcoma, he had surgery, he had radiation, and then within less than 2 years it came back, and it came back with a vengeance. It's too late to do anything about my brother. Often I find myself wishing that we had known what I know now. I do think from things I've read most recently that it's quite possible that he could be alive now.
By continuing to deny safe access, our friends, our loved ones will continue to suffer.
As a result of my military service, I injured my knee and developed an arthritic knee. Also suffered some events that caused PTSD, and I've always had difficulty because of that. Well, we started to spend quite a bit of time in California. I was able to get a medical card while there. And with a little bit of reading, I decided to take just the oils, the CBD, and sometimes the THC. And within a few days, I noticed that I'm walking around, I'm not having the pain that I used to have. And I was really surprised at how quickly and how well it worked.
And the PTSD has been a big issue throughout our entire marriage, that he has had fitful sleep, he wakes up, he can't go to sleep, and so that helped a great deal.
You have to find relief. You can't live in excruciating pain. That's when people are going outside to look for other alternatives, such as harder drugs like heroin. I know individuals that have the exact condition, the same presentation of me, that are being helped every day from cannabis. My problem is that it's illegal here in Utah. I can't access it.
The first time that I had my eyes open to the possibility of having cannabis in a role to treat a medical condition was when my mother had a hip replacement a few years ago. The hip replacement became infected and had to be removed, and she was in a great deal of pain, so she was prescribed opioid medications, but she could not tolerate the side effects, notably severe nausea. She could not tolerate the medications prescribed by the doctors to treat the nausea, so she used a type of cannabis formulation, and it took care of the nausea completely. She was able to use the opioid medications to reduce her pain, do the physical therapy, and she recovered. Since that time, I've had much more of an open mind about cannabis and how my patients use it and how they're able to benefit from it, and especially significantly reduce or even eliminate their use of opioid medications.
Legislators and others who are very much against marijuana may find that they've solved this problem, that we have everything that we need, but we have found that with that little bit of THC, it makes a huge difference for him. And so thinking back on the past few years, if we would have had the support to have cannabis accessed right up first, who knows what would have happened. How much that would have slowed the progress of his damage in his brain, and how much that would have affected his quality of life with not having those seizures so often. He's able to run and play and do things that he hasn't been able to do for the past 2 years now that he's taking cannabis. And if he would have had access to that, this needs to happen now. It's not fair to him, and it's not fair to others who are going through this experience. I'm okay.
When I graduated from medical school, I took an oath to first do no harm to any patient. Cannabis fits perfectly into this because it's such a safe substance. Whereas opioid medications, even when I prescribe them for short periods of time in small quantities, can lead to addiction. Cannabis does not have that same addictive quality. It's important to understand that while more research needs to be done to identify additional uses for this plant, the safety profile has been well established in research.
We can't wait for FDA approval. That can take years, if not decades. Patients need access now.
People are dying every day in this state and in this country from opioids. There's never been a known overdose from cannabis.
Yeah, I think that we both feel that the government has kept us in the dark. And many of the things that we've been taught are just plain wrong.
Many people are led to believe that cannabis is criminalized today because of research showing that it's dangerous. That's simply not true. Congress had no scientific reason to outlaw this medical treatment.
In fact, it was used commonly up until 1942 when Congress started to limit and restrict its use. In fact, it was the American Medical Association who fought strongly against its exclusion from use as a prescribed medication.
You know, when I look at it from the standpoint of all the veterans that I have seen and the things that they're dealing with, it's hard for me to believe that we cannot help them by giving them this option if they chose to go with it.
How many other people are there out there right now who have similar conditions and who don't have access?
There are many pain patients that are out there suffering. We are the silent minority out there, and we need some relief. We want to be able to have the freedom to live our lives. And if that is by using opiates or using a plant that's even more safe like cannabis, that's what's needed.
Matthew's needs really can't wait. It's not something that I can put off and just wait for someone to do tests and studies and eventually decide that that's an okay thing for me. He needs it now. And there are other patients out there in the same situation. It's not really fair to put that decision into anyone else's hands but the parent and that child.
Why are we waiting? Why are we causing people to suffer and die?
The important thing, I think, for people in Utah to know is the truth. And you can't get at that without studying it, without having the research, and without having people talking about exactly what cannabis is and what it can do.
In the past few years, we've seen many Utahns rethinking medical cannabis. My own father, a narcotics officer for nearly 30 years, has changed his position. If he can, so can the rest of us.
Yeah, it is very upsetting for me to see a potential treatment that exists for patients that's safe, to which they cannot gain access simply because it's illegal. I don't believe that this is immoral or unethical, and it's very, very safe. We need this option for patients. We need it immediately.